Okay, I think we'll go ahead and get started. Good afternoon. My name is Jamie Haberl. I'm the Executive Director at the Iowa Healthy Estate Initiative, and we are thrilled to have all of you joining us here today. Just a couple of housekeeping items before we get started with our speakers today. Just a reminder, if everyone could please mute, that would be great so that we can make sure that we prevent any background noise. This is being recorded, and we will be sending out a link to the recording later today or even early tomorrow at the latest. Just a little bit of background, Make It Okay is a campaign of the Iowa Healthy Estate Initiative, and we are thrilled to be partnering with our partners in Linn County to bring the Walk Alongside You webinar series today. And in the follow-up email that you will receive, you will also see links to all of the previous webinars that have been hosted by this great team that you have in Linn County. So I'm going to turn it over to today's moderator, Ms. Carol Mead, and let her take it from there. So thanks for joining us.
Thank you, Jamie, and thank you all for joining me here today. As Jamie said, I'm Carol Mead. I'm the Director of Behavioral Health Services here at Unity Point in Cedar Rapids. And we're happy to present this session, Walk Alongside You, for employers and employees. We're going to focus on strategies to support the mental health needs in the workplace. These past 17 months with COVID have created lots of changes and uncertainties in the workplace environments, coupled with the stressors of balancing work and home. The Derecho last August compounded those stressors for those of us here in the Linn County area, and also compounded those experiences for employers and employees. Our panelists today will talk about what you can do as an employer and or a team member to help provide optimal mental health and support for your team members. So just a little overview on what is Make It Okay. It's a community campaign really designed to reduce stigma by starting conversations and increasing understanding about mental illness. That's one of the things that I love about the Make It Okay campaign. It is so simple. Part of what we're doing today is learning about the impact of stigma and how we can approach things differently in the workplace. We will give you some scenarios and tips for talking with other folks, specifically in the workplace today. And then hopefully we can begin to talk about and think about how we can share the Make It Okay campaign in the workplace. So we started the Make It Okay virtual series last year to start to create awareness and stop the stigma. We really were talking about this before COVID, but once we got in the midst of COVID, we really knew how important, how much more important this was. And after our first initial sessions, we received many requests to expand with some more specific focuses. And we also want to give information on what to expect when you or someone you know someone you are supporting gets help. So those 3 sessions were supporting kids and adults, supporting employees, which is what we're doing today, and hopefully a 3rd session yet to be identified. So just a little bit of information about mental health in the workplace. Globally, workplaces lose an estimated $1 trillion with a T each year due to employees dealing with mental illness impacting their productivity. 1 in 5 people are diagnosed with mental illness. The other 4 out of 5 people either know someone with a mental illness, work with someone who's impacted by mental illness, and or have a mental illness but has not been diagnosed. The majority of the people are fearful to talk about mental illness and mental health due to the stigma surrounding it and the possibility of losing their job. When people do not talk about mental illness, they're more likely not to seek treatment. And we know that 80% of mental illnesses are treatable. We always like to throw out our resources for you. So if at any time now or later, you need some assistance, remember the National Suicide Hotline, our amazing Foundation 2 organization that's right here in Linn County, their crisis line, the Iowa Warm Line, which is a place where you are able to communicate with a peer and just have an opportunity to talk. And then also want to highlight the Make It Okay Employer Toolkit. You can see the link below, and hope we may add that in the chat for you. If you would like to register your workplace as a Make It Okay employer, there's just a really nice toolkit and resources available for you. Here's some more examples of what you'll see in that toolkit, including letters that you can send out to your employers and strategies for you to use in your organization. Also want to shout out to some of our local resources, many of who have helped us with this campaign here in Linn County. And obviously there's more of us, but these are some really amazing people who have helped us here in Linn County. And always want to remember NAMI, who is able to support you and your family and provide resources for anybody who's struggling with mental illness. There's an event coming up next week that we hope many of you are able to join us. It's a panel here in Linn County that will be focusing on decriminalizing mental illness. We have some excellent panelists for that. I have the, I'm honored to be the moderator for that event as well. We recently decided to make that a hybrid event. The panelists and myself will be live, but the rest of you can join via Zoom. You'll have the opportunity to ask questions and interact with the panelists there. And so without further ado, I'm going to go ahead and introduce the folks that you guys have really come to listen to. As soon as I get their bios up, here we go. So first I'd like to introduce Dr. Cindy Hannawalt. She is a physician, Health and Wellness Director and COVID Employer Liaison for Unity Point St. Luke's Workwell Solutions. She obtained her medical degree from the University of Iowa and has a master's degree in community health and doctorate in preventative medicine and environmental health. She is board certified in family medicine with certifications in wound and hyperbaric medicine and DOT medical examinations. After serving in the community in the Cedar Rapids community as an independent primary care provider for 18 years, she joined the occupational medicine clinic to further her interest in injury prevention, care delivery, and cost containment, stress management, and wellness. She serves on the Unity Point Diversity, Equity, and Inclusion and Competency and Healthcare Committees, and has recently been appointed to the Iowa Medical Society Board and has been selected as a delegate to the National Safety Council. She enjoys spending time with her family, being outdoors, and a good comedy, and helping others. She and her husband hope to eventually retire in a warmer climate, but until then, she is committed to keep the workplace and workers safe. Coronavirus disease 2019 is a respiratory and vascular illness caused by the novel virus SARS-CoV-2. Since the first case in Wuhan, China in December 2019, this viral illness has spread globally, causing significant morbidity and mortality, social disruption, and economic loss. Dr. Hannawalt has spent the last 18 months helping healthcare workers, employers, churches, school systems with mitigation education to help stop transmission. As medical experts are working tirelessly to help end vaccine hesitancy and provide effective pharmacological treatments, mental health challenges related to illness loss and mitigation strategies are increasing. Dr. Hannawalt has put together information to help people understand the impact of coronavirus disease 2019 and has had on mental illness and identifies ways to help cope with stressors in a healthy way. We also have Mark Hudson, attorney and senior vice president of Shuttleworth and Ingersoll PLC. Mark's work focuses on labor and employment compliance and counseling, including personal policies and decisions, workplace investigations, affirmative action program compliance, wage and hour advice, and general employment counseling, labor and employment litigation, which includes equal opportunity, wrongful decision discrimination, sexual harassment, and defense of employment-related claims, workplace training, including sexual harassment, workplace civility, bystander intervention, privacy and data security compliance and litigation, and fair housing litigation and compliance. Mark is also very involved in several community organizations and boards. Please join me in welcoming our panelists. And I'm going to start today by handing it over to Dr. Hannah Walt, who's going to give us just a really nice overview of the impact of COVID-19 on employers and mental health. So Dr. Hannah Walt, I'll hand it over to you to get us started.
Awesome. I know you did this warm up. All right, without any further ado, I want to thank you for this opportunity to create awareness for mental health. I'm going to start by just sharing some information about COVID-19, what we've learned, where we're going, and how we can help appreciate the mental and the physical impact from this disease and to help our employers keep their workplace safe. So COVID-19, we know it's a new virus, but despite modern advances in medicine, it really did take us by storm. We weren't prepared for the amount of illnesses and the travesties that are associated with this illness, both personally and professionally. And we've all learned over the past year and a half how it's impacting how we work and how we learn, how we grieve and how we celebrate. And what we're finding now is that it's not going away. And so we have continued immediate problems associated with the COVID virus, the mutations that are coming our way, and then how do we prepare for the next year in continuing to keep our employees safe and well. So health and well-being, how has it impacted us? Well, this virus has impacted us because it's made us sick, but in addition to the personal illnesses that we're seeing with this, it's created a lot of fear. That fear is a key element as it impacts our mental health. We're fearful of getting sick. We're fearful of getting sick again. We're fearful of giving the virus to somebody else. And we're fearful of all the things that are impacted when our health is not up to par. It's caused a lot of confusion. We've had mixed messages. Individuals aren't sure what they should and should not be doing. We've had unprecedented losses, loss of loved ones, loss of resources, loss of childcare. We've had a lot of consequences associated with the virus. The consequences that we're going to talk about today have impacted our productivity as individuals, and it's created a unique circumstances for our employers to be able to maintain a healthy workforce. And it's caused a lot of social stigma. Individuals feel like there's something wrong with them when they contact COVID-19, but now when they don't feel well, even after recovering from the disease, the long-term effects of COVID has created individuals a personal sense of feeling like there must be something wrong with them. They're not strong enough as we head into the continued impact of COVID-19 as we look at individuals blaming themselves for not feeling quite like themselves in order to be as productive as they want to be. So understanding mental health and well-being, I just want to review some terms to make sure we're on the same playing field as we give you the information today that will help you better understand the impact of mental illness on health and well-being. So mental health by definition is really just the way we think and feel. It impacts our ability to deal with ups and downs. It's sort of, you know, we can be physically strong to lift something. We also need to be emotionally strong in order to handle the challenges that we face. Mental well-being is the ability to cope with the day-to-day stresses of life. That allows us to work more productively. It makes us interact more positively with others, and it helps us realize our own potential. Learning from adversity, I think that's important for us to look at over the next 30 minutes, the direct and indirect effects that the pandemic has had on us physically and mentally. Look at how we cope with stressors. We know when we are physically ill, we rest. When we are emotionally ill, we tend to look for our own self-care to make us feel better, and that has led to increased substance use and increased suicidal ideations. And then lastly, I just want to talk about finding resilience, and that are the ways that we are going to offer you today to help individuals better cope with stress, help them maintain control and purpose at home and the workplace, and to empower us to help each other to get through this. So factors influencing mental health and well-being, it's important to know what is protective. What are those characteristics that we know from a baseline allows us to be stronger emotionally and physically? And that has to do with social support and healthy relationships, taking care of ourselves, knowing that it's not just taking care of blood sugars and high cholesterol and treating our cancers, it's also treating our emotional self and being able to identify and give ourselves some grace when we are experiencing challenges. It's that financial instability and employment, feeling secure in our job, regular health checkups, making sure that we take care of ourselves and others. And then lastly, focusing today on that safe workplace from all hazards, physical hazards, but as well as that psychological safety that we're going to talk about today. So challenges caused by the pandemic, I'd like to think about those in means of direct and indirect. So I mean, direct, the fact that our coworkers, maybe some of us personally, we've endured an acute illness and there's coping with the lingering symptoms. So those long COVID-19 symptoms we're seeing 6 months after the disease are very real. Matter of fact, we have COVID clinics coming up now to help individuals return to work. So individuals that are in physical jobs, they've had some impairments, and so working with that. Looking at some of those unexpected losses that we've seen, loss of our own physical health, as well as loss of loved ones in that grieving time. The morbidity and mortality with the pandemic is continuing. And then looking at pandemic fatigue. And I think it's important that we realize that this pandemic fatigue is that we've been this heightened alert. We've had this fight or flight, this stress response over 1.5 years now. And that's wear and tear. And it does create physical symptoms, but it also creates a situation where we're just tired. We're tired of all the mitigation. We're tired of changing the way that we work, the way that we live. And so we're kind of setting ourselves up for increased risk because we're putting down our guard because we're wanting to get back to normal. And the social disruption associated with the mitigation strategies, we've learned that very well over the past 1.5 years, the impact that isolation has had on our mental health, as well as our children and families' health. We've also realized that our access to services have been impacted by fear of having individuals in our offices as medical professionals, has decreased individuals wanting to come for their care and their follow-up appointments, and that has since limited our availability of resources. So our individuals are still working and still trying to be productive without the same resources. And then lastly, I can't end the slides without just recognizing the inconsistent messages. As we have an environment of inconsistent messages as an employer, making sure that your communication and you're consistent with the messages that you're giving will help bring comfort and well-being to our employees. Public health distrust has been prominent, and so making sure that you're the keeper of information so they know what they should do when they feel sick, what should they do to help protect themselves at the work site. So let's look a little bit about the indirect impact of COVID-19. That excessive worry, fear, and stress, those are things that impact our psychological well-being. So it's not fear of getting sick ourselves, but giving it to a coworker and the stigma associated with that. Also the fear of losing our job and the fear of not being taken seriously. A lot of employers, it's difficult when our employees call in sick, but if you create an environment where individuals feel that they cannot be honest with how they're feeling, that's when they will start to hide things. They will hide their physical conditions as well as their mental conditions. I also think it's important we look at the loss of childcare and how that has impacted our employees, particularly with telework. So all of a sudden we have individuals that are working from home, but yet they have children that are also in the house with them. And how do they handle that stressors? How do they try to conduct meetings when they have small children and they maybe have lost their childhood or their child care, or not having means to be able to pay for the child care because they would have been in school. And then lastly, just talking a little bit about the pandemic. I'm going to spend the next few slides talking about some of the emotional impact of the pandemic and what we've seen. We've seen increased domestic violence and child abuse associated with the pandemic because of all the stressors, all those social factors that are also impacting us. So when we look at psychological distress, to the right side of the screen, those are just things that the physical symptoms that can manifest from our mental health. That's the feelings of panic, people having a racing heart rate, feeling short of breath, some GI symptoms. Sleep is disproportionately affected. Our concentration can be impaired. And in general, our appetite is suppressed. We use substances more. So look at mental health, substance use, and suicidal ideations. What we've learned from the pandemic, that within the first 6 months of the pandemic, we had 40% of the United States adults that reported they were struggling with mental health as well as substance use. So we had an increased number of individuals having symptoms of anxiety and depression, but also some of those post-traumatic stress symptoms, increased feelings of suicidal ideations, and those were disproportionately. We found our essential workers had a higher percentage of those feelings, and especially our self-reported unpaid caregivers, because now we have individuals that have lost care for their loved ones. And then we've also seen an increased use in substances recreationally. Marijuana use went up, as well as alcohol consumption. One study showed at least a 14% increase of alcohol consumption over baseline. A third of those individuals were reporting high risk alcohol consumption. Alcohol is a central nervous depression. It is a legal substance, but individuals can have impairments because of alcohol use. Addressing concerns before they become serious problems is an important step in creating a safe, healthy, and productive workplace. So coping with the aftermath, that's where we are now as we segue into the rest of our talk. I think it's important to know that we have a pandemic that is still ongoing, and we're still struggling with some of those mitigation strategies. We've learned what has been helpful, what has not been helpful, and we're still learning how to best treat the coronavirus, as well as other viruses as we head into cold and flu season. So tips for helping others. Whenever we have those hard conversations, it seems like it's easier to talk to somebody, you know, if they have a broken bone or if they have something physical. But when we think that somebody's just not quite acting themselves, it's often difficult to find the right words. And the best thing we can do is just ask, just showing that concern, asking, how are you? And creating an environment where you care what the response is. And so sometimes we just want to follow that recipe, or we want to follow a script. And it's creating that network within our workplace. It's creating a culture where our supervisors are trained to ask those questions and to ask it in a way that individuals feel respected, and they feel like they won't be judged. They feel that they won't be discriminated against if they're honest with just not having a good day. Being able to offer help at the right time, as well as the right type of help, and being ready to receive what somebody else is going to say. So being able to talk about those hard topics, even when you don't know the correct answers, but just being there to keep conversations going and give the right advice. So tips for talking to people with mental illness. This is basically my last slide. This is going to be part of your notebook. This is directly from the Make It Okay campaign. As Carol shakes her head, yes. I put this on here because I think, you know, as we've all grown up in different generations, different circumstances, and we've kind of had, so, you know, that tough love and that soft love. And sometimes it's just easier to say, you know what, leave it at the door. You're at work now. You know, everybody feels like that. So looking at the right hand of the screen, things not to say, we found that, you know, by trying to minimize, I think we feel like we're doing our coworkers a favor by saying, you know, you're not alone in that. I felt like that. But that makes them feel like they don't matter. It makes them feel ashamed that maybe there's something wrong with them because they feel this way. So just opening the door and reassuring individuals that it's a good thing that they're opening up and that you're glad, and just listen. We want to fix it, right? We want everybody's problems to go away so we can be more productive, and recognizing that we can't fix the problems they have, but we can create an environment where they can share and they can get the help they need. As Carol pointed out, 80% can get better, but they have to get there first. So I also left some resources that I commonly give to employers to access, and then just some references if anybody wanted to look further into some of the slides that I gave. So that's my background. I'll stop sharing this. So we can get forward with our panel discussions. and get your questions answered.
Awesome. Thank you so much. That's really great information that you shared, Dr. Hanwalt, and I think really lays the groundwork nicely for the conversation we're going to have. Before I kick off with the first question, a couple things that I failed to mention at the beginning. If you as participants today have questions, feel free to put those in the chat box. Jamie will be helping me moderate or monitor those. And also one question that as we're discussing today, if you as participants would like to share, what are some things that you or your organization is doing to help support mental health in the workplace? I think it'd be great if we could share some of those things amongst ourselves today. So Mark and Dr. Hanwalt, I'd like to start by just asking, what are some things that employers could be doing to proactively address mental health issues in the workplace? Dr. Hanwalt, do you want to start with that?
Sure. So I think by leading into my discussion today, I think proactively is just what you're doing today, and recognizing that it is a problem, recognizing that we have been through a year and a half where people have had emotional and physical distress, and they've had circumstances in their world that made it more difficult to take care of themselves. And so just recognizing that our workers are struggling, that our workers need resources, they need information, and they need support. I also think it's important to know that, you have to prepare for this. And so, we were pretty good about the mitigation strategies with COVID-19 is that, all of a sudden it's like, what do I do to keep everybody safe and mask and distance and all those things? And you made this coordinated effort, that same effort being put forth with psychological safety. So most of us are aware of OSHA and we're aware of that general duty clause. And it's easy to say, well, I'm going to decrease accidents and slips and falls, but proactively recognizing that psychological hazard evaluation is just as important, in many cases now more important, particularly with business and industry that is not just physical labor anymore. So it's really that emotional impact, that psychological well-being that we're seeing more in business and industry that has more telework and more computer work and more desk time and more mental distress and the burnout that's associated with it. So getting yourself educated, getting your team involved, making sure you have somebody identified that's going to take the lead, and train your supervisors, train them not only to look for increased physical conditions, but as well as mental health conditions.
Well, and I'll thank you Dr. You have great comments. I'll also add, I'll tell you one of the things I think is really critical here is that this has actually not been it's not a new issue. Employers have not been good at dealing with this for decades. Just like we used to, everybody has their signs that say wash your hands when you come back to work. People didn't necessarily do it. If they said, if you're sick, don't come to work. People would, we would applaud people that came to work sick because that means they're committed to the workplace. That means that they're really putting it in. They are committed to get that project done. They're committed to you. And we would actually show that as a sign of how a good employee is. And now we're coming to realizing we're leading the consequences where it's the exact opposite. And we need to start thinking about how to have these conversations and this is specifically for HR professionals on this, is we've been avoiding conversations that are hard for a long time. Dr. Hanwalt had a comment about difficult conversations. It's one of the biggest issues. And interestingly, it doesn't just stop with mental illness. It can be racial issues. It can be harassment issues with the Me Too movement. It can be with COVID. It's the same kind of principles that we are afraid to have conversations. And what happens is things build up until we have people walking out on jobs, unhappy that something's happening. Whereas if we would have had conversations earlier and able to do that, but they're difficult. And then sometimes, I'm originally from Arizona and I've moved around. I was a military brat most of my life, so I moved around a lot. But the idea of Midwest nice, and I hate to put this out there to people, it really actually prevents sometimes having a hard conversation because we weigh the benefit of, how are they going to feel? Like, they might be put off if I ask them, like, are you okay? How are you doing today? Because, you came to, we all know when people come to work and they're disheveled and they look like they've gone through it. They didn't sleep well and they walked into work. You're like, oh my gosh, someone had a tough night. But we avoided to say, how's everything going? Rather than having those conversations. And so part of it from an employer standpoint is it starts with, first of all, it does training supervisors and folks to have these conversations, but it also goes back to your culture. How have you created a workplace culture that is based on trust and that you're actually working to have them succeed, your employees or your supervisors? Because one of the underlying issues here is that we want people that have a mental illness or a mental health issue to be open about that. But those individuals have to trust that you're not going to sit there and go, oh no, oh, okay. And then all of a sudden they get ostracized. And frankly, it's a self-fulfilling prophecy at sometimes. So part of what we have to do is create a level of trust in our organization that I can tell you that it might not seem like a big deal to you, but it is to me and it's affecting me. And how can we help get past that or move past it, get me the assistance or have me figure out whether it's a coping skill or maybe I need some, EAP assistance so that I can get that obstacle out of the way so I can get my job done. And that's the ultimate goal. But what we lose sight of is sometimes we say, well, I'm not a psychiatrist or a psychologist, or I'm not, and I think what Dr. Hanwell also, I appreciated a lot is sometimes it's just asking, how are you doing? It's open-ended questions, not saying, hey, look, you look like you just, got hit by a bus. No, you say, is everything all right? And I didn't say anything. I didn't say you look like you look like, like you just, got hit by a bus. Is everything all right? Like as if something was different. It's one of the things actually, Emily Bloom from a foundation too, I was doing this conversation with this, and she was requiring people when they do Zooms to put on their videos. Part of the reason why is it was a check. It was a mental health check because, a lot of people got beards during the pandemic, but also a lot of people let a lot of things go and were not necessarily ready, or maybe might be laying in bed while they're on the phone call. But if I have a nice cute picture that I have, a professionally done picture there, you never know the difference. There's my picture. You never know the difference if I'm in my pajamas laying on the, with Cheetos next to me. And if you know me, that's not my normal, just so you know, I might be a big guy, but that's not my normal thing to be looking, in a bed with Cheetos next to me. But clearly that would be a different behavior for me, and enough to say, what's going on, Mark? You okay? It's a little different, because one of the things, and same thing we have with masks now, some of that interaction that we're used to seeing, a smile or a facial expression, we're unable to see that. And we even see that in my office where we shut doors more often now. Before the pandemic, not a single attorney's door would have been shut. And now pretty much everyone's door is shut because it's like we're trying to isolate. So one of the things I would tell proactively and what I would encourage is that you have to take actually intentional acts to create interaction and trust and engagement. And if we don't do that, we're going to lose people, whether it's remote work or whether it's anybody. But we have to engage people at where they are at, give them the door to walk through. And if they don't choose to walk through it, that's their choice, but we continue to open the door for them. And we continue to do that. And that's our job as employers. Just like if their person was a mental health issue, but was poor performing, we'd open the door to get better at performance. And we would keep on opening that door, but they still have to choose to step through it. And that's something I think employers, we lose sight of sometimes because we are so busy that we don't have the time to think that we don't. But the question is, frankly, in this labor market, you have to make the time, because right now, it's not as if there are hundreds of workers ready to go work for you right now. Look at just all the job postings, and everybody just absolutely desperate for that. So it's really important to be, so for me, it's starting with culture, and then secondly with training.
Excellent. Thank you. Thank you both for that. Listening to you, Mark, one of the things I reflected back on was, when my kids were in school, they used to give out perfect attendance awards. So at a very young age, we're teaching people to go to work when you don't feel good, go to school when you don't feel good. I hope that schools have sort of stopped that, but
Well, actually, I'll add to that. And it's the same issue. We teach a lot of our kids things that are like not necessarily the best thing. My son, when he was 14, we were talking about bullying, and we were talking about the behavior. And I asked him if someone was bullying my daughter and his sister, would he report it? He said yes. But then I said, what if your friend is doing it? And his answer was, I'm not a snitch.
Yeah.
And so sometimes we've taught and by the way, that snitch is more of an aggressive one. If you're a kid, what are you? You're not a tattletale. Yeah. Don't be a tattletale. And the same kind of thing is that we teach like this psychological toughness. And Dr. Hanwalt might be able to talk about this, but I also think it's a gender issue too, because I think that there are a lot of males that are taught when they're young, you can call me whatever, it's not going to ever affect me. So then I can't show that you actually ever affected me emotionally. Yeah. You could call me everything in the book. You can call me names. It's never going to affect me because I'm tough. And the reality is that doesn't mean inside we are. And it's one of those issues that when you've learned that behavior, that you then act like other people should act that way. Like, there's no crying in professional settings. Yes, there is. Yeah. I've seen many of attorneys just flat out cry when they lost. Yeah. And you know what? It's because they put so much into it. And frankly, to me, what it showed me, not weakness, it showed the fact that they cared. Mm-hmm. Yeah. The fact that they were that invested in succeeding, that they were wanting to have that outcome. So to me, what we have to do is get beyond that part of, the image that, the kind of the stereotypes that we want to do, and realize that, how can I help this person be a good employee? Yeah. And how can I help them to get their job? They might not be able to, by the way. Mm-hmm. It's okay. Sometimes we don't succeed, but I will want to have taken all the steps I can to help them succeed.
Excellent. Thanks for that. Kind of moving from, that proactive, things that we can do to, what can an employer, a little bit more specifically then, coming in a little closer, what can an employer do or a team member do if they're concerned about somebody's, either an employee or a fellow coworker's mental health? So what are some specific strategies that you would give people?
I'll go ahead and go first, Mark, if that's okay. So, the specific strategies, we talked about that training our supervisors. And so, there is a mental health first aid program. So, we can treat, CPR and those things that worksite with. There is actual specific programming, which is very valuable. I know Tanager Place has been doing some work with this. There's some online services, and Carol may have some more information on that. But making sure that you designate individuals to have this specific training to go through. And so, and that's really the training, the key parts of training are just kind of that action plan. And so what are circumstances? What are some identifiable factors? Our drug-free workplace training that we do here at Workwell, we can help you identify when do we think somebody is using or under the influence of a substance. But there are just some general things, and Mark even talked about that, just being disheveled, not showing up on time, maybe some mood changes, maybe their work performance is a little bit different. So once you know that just something doesn't seem right, how do you approach that individual? And approaching it in a non-condescending way is important. And just that, say, how are you today? And, you're leaving, webinars like this is like, okay, we're going to do that. Well, you have to do it across the board. And so I just want to back up a minute and say, we need to create an environment amongst people we work with and each other that is just common, that we ask, how are you today? That should be something that we expect to ask each other how they're doing. So it doesn't create a surprise, like, why are you asking me today? And what is it about today? Because then we get a little bit paranoid and we're fearful. I'm like, is there something wrong with me, or am I in trouble? Those type of things. And so being able to approach individuals just in a kind, caring way is important. And being able to approach individuals and assess the situation. Are they in a crisis? And so asking, say, how was your morning? what's going, having those conversations and deciding, are they not acting correctly? Is there something about their demeanor today that you think that they're in a crisis? And when do you need to reach out for immediate help? Or when can you just get some supervisor and some workplace support? The other thing is just about listening. Sometimes it's just asking and listening and not trying to fix their problem, being non-judgmental. And listening in a way is like, how are you today? Maybe they're a little slower on the line. Maybe they're a little slower of getting emails responded to. When you ask how they are you asking with, your body language, with your hands on your hips or your arms crossed? Or when they say, I just don't feel good today, because what, they've called in 6 times this month already because they're having some problems. And so it's that attitude that you feel like, are they just malingering? Are they just trying to get out of work? And we have to be able to check ourselves about how we're judging as we're trying to ask the right thing. And so we really need to just be kind, and to realize, why are we asking? We're asking because we care. We're asking because we know it's going to make everybody better in the long run. And then encouraging individuals, when they do share that they're not doing well, encourage them to take care of things, or encourage them to take a break. It's not a matter of just counting to 10, but encourage them to be able to talk with coworkers, to talk with management, encourage those conversations where people can share openly about what their needs are. And perhaps they're feeling frustrated because their schedule is full, maybe the work demands, maybe there's a mismatch in those things. And so as you talk to individuals and you want to hear what they have to say, you have to be willing to have that programming in place as well. And when you talk to individuals, make sure that it's a generational thing. Maybe it's a gender thing, but it's, talking to a millennial is definitely different than talking to a baby boomer. And we need to understand the differences in how people take conversations based on where they're at with their life. And then just offering engagement and support and follow up and asking them over time. So that's kind of that first aid in a nutshell.
Good. Mark, would you like to add something to that?
Yeah, absolutely. I would say creating a safe place. You need to create a safe space, because the answer, even when you ask, how are you doing? I can count on the hand how many times I've gotten a different answer than fine, okay, good, well. Those 3 answers. I actually had one the other day, and they asked me if I wanted to lie to them. Because they didn't want to say fine or well. I was like, oh wow, that's a new one. That's honest. And then my next question, because actually my first response was, oh my gosh, what am I supposed to say to that? Like, what do I know? And that's part of the training aspect of it, is how do you have a conversation when you're uncomfortable? And you're uncomfortable and part of the reason people are uncomfortable is that we don't know what to do necessarily. And that's, by the way, that's okay. And it's okay not to know exactly what to do, because we're trying to fix it. Just like, sometimes when my spouse calls me and she tells me a problem, my first thoughts are, how do I fix this so I can get off the phone and get back to work and blah, blah, blah. And what she wanted to do is just talk to me. And so part of it was, and I stopped, I went back later, I said, is everything okay? From your answer. And she said it was fine. Now, what I'm going to do is also follow up in a couple of days to say, is everything getting better? Is it getting better from the other day? Just to give her another opportunity to say, here's what's going on. Because, frankly, especially in power roles, when you have a supervisor or different levels of staffing, nobody wants to be telling their supervisor what drama is going on at home or what they're going through, because they really don't want. They're afraid that it will affect their job performance there. And so part of what you have to do is open up and be that person to have a space to be able to talk about it.
Excellent, thank you. So kind of, again, I think digging even a little bit deeper, I wonder if you guys could share some common scenarios that employers may need assistance with as they're navigating mental health and mental health concerns, and what are some sort of how-tos to help them navigate these situations that we're talking about today?
Well, I'll throw out one, and then if Doctor, you can go next of this. So I'm going to throw out one that I think is a lost art in HR, and it's partly to blame for HR and attorneys, because we've gotten away from asking why people are gone. We get away from, why are you late? It's almost like we've created policies like a paid time off policy. So We don't want to know why they're off. It's, you know, it's not vacation or sick, so they don't have to explain to us. They just tell us we're off, and then all we do is count numbers. So to me, one of the scenarios that I think that are impactful here is that when we do notice people like, you know, what was going on yesterday? You know, you were absent. What happened? You know, how are you doing? Are you okay? And if you're asking those kind of questions, not in a judgmental way, and it's important that you're not going through it, because right now, one of the bigger things I think in employers that we're failing in a little bit is we're not creating a workplace that we are actually invested in their success versus trying to catch them violating rules so that we can fire them. And so when I have an absence, instead of thinking that when they ask me, what was I doing, or how am I doing? Are you okay? I'm thinking, oh, they're trying to find out if I was skipping work, or they're trying to, you know, 8 absences, I'm going to be fired. What they don't believe is that you're trying to find, is everything okay? You know, because for example, one of the major absences for females in the United States is domestic violence. But how many people want to go to work and say that, you know, my spouse was abusive to me last night? Nobody in the world wants to walk in the next day and say, you know, that they had to pull their kid and try to find a hotel to live in or a shelter to go to that night because their spouse was abusive. They want the perception to be that I have everything under control. Got everything done. And, you know, and the reality is none of us have all control. I mean, I'll disclose to you, I mean, to everybody here, is that, you know, my mother-in-law had a stroke last Easter. So my brother-in-law and mother-in-law are living in our house. I will just tell you right now, having 2 new people in our house for that long is a stressful environment for my house. Doesn't matter if there is enough space, just the idea of having to add in 2 people that have, you know, they've been living in Montana and lived literally in the same house for over 50 years. And now are in Iowa, transplanted here just, you know, simply after a stroke because she's physically, and they're working on that. And that creates a huge amount of stress on my entire house. So, you know, I was actually happy when we went back to work because I had needed that time away. You know, the same thing was happening when folks were required to be remote work, where we used to have a little bit of a break by going to work. Now we're stuck in the house with some of the things that we might not have dealt with all the time. You know, we might not have dealt with our partner on 24 hours a day. We might not have been ready for those kind of things. We were used to different breaks apart. But part of what I think we have to figure out is how are we having better conversations? How are we engaging them? You know, at the same time, one of the risks, and this is what people will say a lot of times, is like, you know, I don't want to, there's not a couch in my office to go, I'm not a psychiatrist, so lay down on the couch and talk to me. But here's what it is. I'm engaging to them so that then I can say, here are some resources to go to. You know, do you need help? You know, for example, maybe it is they need an apartment. Well, there are services out there. Maybe the EAP can be helpful. Maybe there's a benefit program that can get, you know, the help, or there's other ways that people will assist them. Plus, it also then will prevent anything from misunderstanding later when it's the only time you raise the issue is right before you're terminated. You know, if you know, and that's one of the things that employers are very judgmental on. It doesn't mean it's not true, by the way, when they raise it just because it's at the you know, right by the termination. The facts of whatever is happening might be absolutely facts. But what happens is people don't trust the actual conversation. So to me, being very proactive in attendance is critical in making sure that we are engaging and figuring out, because it might be, you know, someone doesn't have a car. That might be a fix we can do. It might be mental health, those kind of issues. So that's where I would start. One of the ones I think is most common.
Oh, I agree. And I think, you know, just navigating, being a better support for our employees, it is making our employers think a little bit differently, depending on what their environment is. I mean, there's a lot of different avenues that individuals can take, but just recognizing where we're at socially in concept, and supporting diversity within the workforce, and recognizing that, you know, we want all ages to a certain level, and we want to, different perspectives, and how that strengthens our environment. By doing that, we have to recognize that I think the biggest thing that I see navigating in the employers that I help is that their supervisors, their managers, it really has to be from bottom up and top down. And so what do we do when we've had these safety supervisors in place that are my age, that we're in our 50s, and we just were raised differently? So being able to have a discussion about our own internal bias is important. And we have to be able to navigate that when we don't, maybe, we personally don't believe that, is depression real? And is that something that is really going to keep you from doing your personal best? And so just buying into these type of medical conditions, it's kind of like having a soft tissue injury. I recently spoke to my brother who runs a business in Northern Iowa. And I said, do you talk to your guys about their feelings? Just trying to understand this certain workforce. And he's like, well, why would I do that? And he's like, you start talking about this and I feel like I have to hold their hand. And he goes, I have all I can do for them to show up to work now. But that hurts me as who I am, but that's the reality of what we're working with. That a lot of times we're, it's just like with fitness programs, who attends fitness classes? People who are already fit. And so we're trying to engage individuals that need our help. And so we have to navigate that. I mean, if behavioral change was easy, you wouldn't need a health and wellness director. And so we have to figure out ways that we can better engage people. And that's recognizing the problems that are very real and offering them support without necessarily having them ask for it. And so we know that our children are struggling. So being a mom is difficult, but it affects everybody. And so trying to navigate what is impacting our workers and just paying attention to that. We know COVID, we're doing that, but now what are those things that we can do? And so like the telework and the isolation that we're seeing, having those times when you turn your camera on so we can see you, but just having a coffee break, because right now we're trying to jam so much into being productive at the work site that we've forgotten that it's okay to just to have that minute. And I know some of you had put in the chat box about being able to have that meditation room and to take that time. But you know what? You want to allow us to take that time without feeling guilty for it, because now it's like, oh my gosh, I have a lunch meeting, or what in my workforce, it's like, you know what, you want to meet with me, but you're taking the only time I'm not seeing a patient. And so when do I get lunch? And so what that does, it makes me feel resentful. And so that's what our employees are feeling. And so you can hand them an EAP flyer, but we also need to just hand them useful tools. And I think that as employees, you're struggling with that. And that's where it doesn't come second nature. So having that consultant to be able to help guide you about having real conversations, giving the right education and knowledge to the people that are leading others, and making sure that they feel comfortable and accepting the fact that if we talk about we're having a bad day, doesn't mean it's going to make everybody soft and just not want to do their job. It does make them more productive, and it encourages them to keep their appointments and to manage their blood sugars and to do all those other things that just make us strong. And that is one of the protective factors against mental health.
And actually, and especially in your area, one of the, when they talk about accidents and safety in that area, you talk about assessing your mental state when you're doing something that might be dangerous, and making sure when you're reliant on other people that you're assessing their mental state. When you're doing a lockout, tagout procedure, and you want to make sure your mind's on the task, they're not distracted. And we talk about those aspects, and nobody will, mock that kind of thing because they know the consequences of it. But the same thing should be applying to when people are performing jobs that are duties that are not necessarily going to lead to injuries. When they're, if they're an accountant and they're doing numbers there, that their mind, there's something going on, and that. The same kind of idea goes when we're doing accident safety, when we're trying to prevent people from, because we talk about, you need to assess your team to make sure you're not going to put people at risk. And the same thing goes when you're working with people, if that they might not be as productive, helping them and understanding, hey, I'm noticing that you're okay. And it's okay to do that because we want to be able to be safe so we can perform well, and that we're committed to. One of the other things I'd add on that part is that one of the things I think we need to improve on in the employer area is that we are committed to helping them succeed. So not just when we find a deficiency or a maybe there's a violation of a rule, but that we actually commit to not just put him on a performance improvement plan for 90 days and tell him to do better. Like, great, because they were really not wanting to do better, and now they're going to. Like, no, that's not the way it works. Like, they've worked there for 5 years trying to do their job, and they're struggling with it. You tell them you have 90 days to improve. Okay, take this training class. But really actually be committed to their success. Work with them. Actually have a conversation with them. Like, what are some of the challenges you find you're having? Instead of just saying, do it better, because that's normally what we do. We'll say, do it better, get more productive, do it better. You have 90 days. I'm going to check with you in 30 days to see. And we've had those conversations. Everybody's had those kind of conversations with folks. And it's like, and then what do? I put a little reminder on my Outlook, 30 days, check in, see how they're doing. As if all of a sudden that magically makes people be productive. So to me, one of the things we have to then commit to is actually doing something. Not just, it's great to ask how you're doing. And if somebody opens up, that's great. But if you just drop it there, literally, what are you going to get? You're going to have someone say, well, that didn't do any good. That didn't help me. It was nice to get it off my chest a little bit, but how are we committed to that person succeeding? And what do they need? And that might actually require, and this is a crazy concept, asking them what they need. What do you need to be successful? Like, for example, somebody's absent so many times. What can I do to help you get on here on time? Like, what are your, because I'm assuming, because I'm just saying, I'll just say, it's your problem. But like actually asking what, and can I do anything? And by the way, they might just say, no, I don't. And that's okay too. But then, checking back in again on them. But to me, the idea is we have to realize that the success for our people are dependent upon our relationships with them.
Yeah, excellent. We are bumping up against, it's 12:59 according to my clock. I was a little worried at the beginning of this with only 2 panelists that we might run out of things to talk about, but you guys have been amazing. A couple of just sort of takeaways from listening to both of you. I think one of the things that we as employers can do is model it ourselves, right? I mean, you did a great job of that, Mark's doing a little bit of being vulnerable and self-disclosure. We all have a little something. We all have something. We're all walking through something. And if we can be a little vulnerable and normalize the stress that we're all feeling, that will go a long way, and walk alongside our team members and be willing to be there for them. Dr. Hanawald also touched on some of the wonderful resources we have in our community. There's several organizations that provide that mental health first aid, and we can get you that information as well. I can connect that with Jamie. And there's another training called QPR. It's called Question, Persuade, Refer, which is a little shorter version of that, but also really good resources for employers to have to help take care of their team members when they're struggling with mental health services or mental health issues. We're at 1 o'clock. That went really fast.
It did. Any pressing questions? I tried to look.
I haven't seen any questions, but if people have them, feel free to put them in there.
All right. Can I just give a closing remark, Carol?
Yeah, please do.
As you talked about that, so I know that I always want to give you useful information. So there are mental health calculators out there. There's psychological safety surveys. Those type of things are up and coming. I encourage all of you to do that just to start the conversations. And then the lunch and learn topics, caring for our demented parent, dealing with our children's substance abuse. I mean, those things that impact us, we need those resources to be better, just as much as I need to be able to exercise 20 minutes a day. Companies that are doing things really well, a lot of you are out there, you're doing them. I appreciate you sharing that in the chat box, but just making sure you have a dedicated person, that this is just part of your normal routine now. And I really appreciate this opportunity. Thank you.
Thanks to both of you today.
Thank you, everyone.
Thanks everyone for joining us today. This concludes the webinar, and you will be receiving a copy of the recording along with a number of different resources that are available so that you can help all of your employees around their mental health. So thanks so much. Have a wonderful day. Take care.